Okay, so I'm gonna do a Foley catheter, so I'm gonna first make sure that I have a doctor's order to place one. Then I'm gonna gather all my supplies and I'm gonna go into my patient's room and I'm gonna introduce myself. So hi, my name is McCarty. I'm gonna be putting in a Foley catheter today, and that's just a tube that goes up into your bladder to drain the urine. And then I'm going to identify my patient with 2 identifiers, so I'm gonna ask for the name and date of birth and just make sure that I have the right patient. And then I'm going to provide privacy, and I'm gonna wash my hands, and I explain the procedure. Sorry, just checking everything. Okay, so I'm just gonna, first I'm gonna clean my patient, so I'm gonna put gloves on. And I'm just gonna pull the covers back. And I'm gonna make sure that they're in the right position, so with their knees up. Grab some wipes. I'm gonna do one side front to back and throw it away. I'm gonna do the other side front to back and throw it away. I'm gonna go down the middle and throw it away and just make sure that everything is clean there before I start. I'm gonna take my gloves off, throw them away, and then I'm gonna wash my hands. So then I'm gonna start prepping my kit. Set this on the bed. Then I'm just gonna label this. So I'm gonna write my name and the date I inserted it and set it aside. Then I'm going to keep my sterile filled, so I'm only gonna touch the 1 inch around the border. So first I'm gonna open it away from me. I'm going to open the sides. Make sure I don't lean over it. Then I'm gonna grab my gloves. Come away from my kit so I don't break sterile filled. I'm gonna open them up. And keeping that 1 inch border around. And I'm gonna grab the outside of this glove. Make sure to only touch the inside. I'm going to put my fingers under this cuff. Place my hand in. Then I could fix my gloves because I'm now sterile. So I'm gonna bring this over, just use for trash. Then I'm going to place the drapes on my patient to have a sterile filled. So I'm just gonna explain to the patient that I'm just gonna place this drape. I'm just gonna drop it so I don't break sterile filled. Open this. And make sure that you're not flinging it around so it doesn't get contaminated. And I'm just gonna drop this so it doesn't get contaminated. You wouldn't normally fix it, but you just want to drop it, get it on the right side. So I have 2 of these, so I'm just gonna set one aside. So I'm just gonna prepare my kit. So I'm gonna open my swabs. I'm gonna open the lube and squirt it into my tray. I'm gonna pull out my urine sample and put it right here in the sticker. I'm gonna pull my catheter out. I'm going to coil it in my hand so it doesn't flip and it stays sterile. I'm just gonna throw that away. I'm just gonna place the tip in the lube. I'm gonna attach the flush to the catheter port. So now I have everything ready to go. And I'm gonna bring my box over to my patient and make sure that I keep my sterile filled. So I'm gonna make sure that I'm over her leg. Then I'm gonna grab my swabs and I'm gonna hold the labia opened. So this hand is now contaminated. So I'm gonna go front to back with one swab and throw it away. And I'm gonna do front to back with my second swab and throw it away. And then front to back down the middle and throw it away. And now I'm ready to insert my catheter. I'm just gonna go in, tell my patient to take a deep breath, and it might hurt a little bit. So I would just go until I see urine return. Then I would go 2 inches further, and then I'm gonna hold the catheter, and I can hold it with my dirty hand because I'm not gonna advance it anymore. I'm gonna fill up my balloon and make sure that it's all the way in so I can tug on it and make sure that it's in place, which it is. So then I'm gonna remove this, remove the flush, and then I'm gonna pull my bag out and hang it from the bed frame. So then while I'm here, I'm going to get a urine sample. So I'm going to take my gloves off. I'm gonna put new gloves on, wash my hands in between, and I'm gonna label my urine specimen and put the date and time and everything, all the information. And I'm gonna explain to my patient that I'm getting a urine sample, and because I just put it in, I can get the urine sample right away. So I'm just gonna grab it and pull the catheter. And then I'm not gonna touch the inside, but I'm gonna open it and let the urine fill up the tube and close it. And place the lid on my sample. And place my label. And then I'm gonna take this directly to the lab so they have the sample. And then if it had been over 30 minutes with the catheter in, I would need to clamp the tube and obtain a specimen in less than 30 minutes because you can't leave the tube clamped for longer than 30 minutes. And then I'm just gonna make sure that I document everything with the catheter and that I took the urine sample to the lab. Oh, and I would need to strap this down to the leg so it wasn't tugging on the catheter while it was in. Okay, so then I would clean up and clean my patient. And then I'm gonna check for doctor's orders to make sure that we can take the catheter out. So I'm gonna make sure that the orders are in, and then I'm gonna come to my patient's room and I'm gonna introduce myself. So I'm a cardi, I'll be your nurse today. Then I'm gonna explain the procedure. So we're gonna take out your catheter. It might hurt just a little bit, but I'm just gonna have you take a deep breath in so we can just pull it out and it will be smooth. And I'm gonna provide privacy and wash my hands. And I'm gonna identify my patient as well, make sure that I have the right patient with the right name and date of birth. So then I've washed my hands, so I'm gonna place on gloves. And I would have come to my patient's room prepared with my syringe and a Chuck's pad underneath just so it doesn't leak anywhere. So then I'm just gonna attach this to the port and pull out the whole 10 cc's of water in the balloon. So I'm gonna deflate the balloon. So then I'm just gonna have my patient take a deep breath in. And then as she breathes in, I'm just gonna pull it out slowly and smooth so it doesn't hurt the patient. And then I'm gonna dispose of all of this into a red biohazard bin. And then I'm just gonna document that I removed the catheter and if there was any complications with it. And make sure that my patient is comfortable and wash my hands. I believe that's all. Am I missing anything? Before I started, I would make sure I took off all my rings and jewelry and like watches and stuff so it doesn't get in the way of my sterile field. I think that's everything.